Paediatric dispensing is a priority for ABDO. We obviously regulated dispensing is our remaining regulated function for paediatrics and partially sighted and blind patients. We do recognise that there is a big problem with supervision of regulated dispensing and the quality of paediatric dispensing. If you stand at any school gate, you can see very poor fitting glasses, children looking over the top, children becoming amblyopic as a result. And so far we've presented our paediatric discussion workshops and lectures to well over 1,000 of our members. So we're making great strides to improve standards. We've got quite a move at the moment to look at re-regulating paediatric dispensing, particularly for the under 8s, so that actually it can't be done under supervision, it must be done by a registrant. And that's something that we will be talking to the Department of Health about that. ABDO's refracting is kind of on hold at the moment. That's because we're not expecting any parliamentary time to be made available for anything other than the government's plans at the moment. So it will need a change of government before any of the changes that this sector is looking for could come about. We'll probably get a technical bill which will give powers to regulators, but other than that we don't anticipate a new Opticians Act anytime soon. It's kind of back to the drawing board a little bit with refraction, but I think in 18 months, 2 years time, that'll be a different story. The optical question time, we had myself and Katrina Veneris, who's the Managing Director of LOXU, and Lyndon Taylor, who's the Chair of the AOP. We had a variety of questions from the audience and some that came in earlier. And the usual topics came up, the cross-subsidy of the GOS eye examination from spectacle sales, the vexed issue of internet sales, the quality of paediatric dispensing, how we see eye care going in the future. I believe that the future is to improve the scope of practice for dispensing opticians and also for optometrists to move more into therapeutics. If we're going to be the hospital on the high street, then we've got a lot of work to do, and I think we addressed some of those issues today. We didn't come up with all the answers, unfortunately. Hopefully we will in due course. ITN came to ABDO and we've partnered with them to spread the word about eye care, really. Their website, healthcarenews.itn.co.uk, has got a lot of healthcare information on it, including primary care, medicine, pharmacy, dentistry and social care, and eye care is really to complete the set. And there's about a dozen organisations now involved with it, and we hope we're going to create fairly generic, useful information to educate fellow health professionals and the public at large.